Now, the next topic which I'm going to discuss would relate to breathing exercises. And I already mentioned duration of sessions, like how we changed during history, like in 70s, 80s, 90s, and later. So we were short, then became longer, then we became again relatively short these days. That is one of the factors which kind of reflects how Buteyko breathing technique evolved in terms of like history. And a related factor here is how much people practice. And for example, Soviet doctors, even up to these days, we teach up to 2.5 hours of breathing exercises. So we advise to their patients, and that was done like by medical doctors, which is a little bit different setting, because in the Western world, most of people, me included, more than 90% of practitioners, we don't have any medical education. We do have nurses, family physician, GP, general practitioners, physiotherapists, and many other health professionals, but it's really a small number of people yet. And what happens here is that in Russia, we teach the students, to the patients, to have 2.5 hours of breathing exercise per day, which is a lot of time because unfortunately not all people have that much time. And on the West, it's more common to teach the students to have, let's say, 40-60 minutes per day, maybe a little bit more than that. And normal breathing course in this area kind of actually goes more in the Western direction. I teach my students to have 60 minutes per day, at least, more recently up to 90 minutes. And although I had many students who could practice up to 2 hours of breathing exercises per day, and that relates to duration of breathing session. It's actually a factor which also can be somehow addressed by improving other things, because if we are able to create more effective breathing exercises and can create effective conditions in other areas, which is again physical exercise, sleep and diet especially, then we're able to have our students to spend less time, because in terms of time investment, breathing exercise of course takes most of the time. Physical exercise would be equal. In some cases it can be, especially for more advanced students, it would be even more influential, more important factor. So here in the area of breathing exercises, the normal breathing course during last about 5 years does not start with Buteyko reduced breathing exercise, which is the main exercise of the Buteyko method. And this is how, for example, Buteyko doctors in Moscow clinic, we teach the technique right now. What I do right now these days, I start breathing retraining, especially with those students who have more health problems, so we take more medication, more symptoms, with application of breathing devices. That can be the Frolov breathing device that I started to use long time ago. I'll explain shortly how it started. And or DIY breathing device, so-called amazing DIY breathing device, which I can make myself for my students. So there is a separate book, Amazing DIY Breathing Device, where it provides all these instructions. But here I would like to mention that even though I teach this application of devices for the normal breathing course, it was actually not my idea to use breathing devices as part of breathing retraining process. So, the original idea to combine the Buteyko method with breathing devices, the Frolov device in particular, was suggested by Leo Volkov. And he is a Buteyko teacher, and he was a translator for the first BIBH, Buteyko Institute of Breathing and Health conference in New Zealand. So we invited Dr. Buteyko actually, and Lyudmila Buteyko, his wife, came in 2000. We came to New Zealand, and he was a translator there. So I had email exchange with him, like private emails. And in one of the emails, he wrote to me, "Oh, I apply the Frolov breathing device, and my students get high CPs. It's like works really well." And I was really curious. Soon later, I was buying like boxes of these, like 24 pieces, like devices in one box, and giving it to my students to test it. Later, I realized that they definitely work more effectively, especially when people are sick. It's more difficult for them to practice reduced breathing. So there are many advantages, as I realized very shortly, of the Frolov breathing device. And later, I developed my own amazing DIY, do-it-yourself breathing device. The advantages which I found by testing on my students was following. It's much easier to practice, because for Buteyko breathing technique, students need to use the diaphragm, but we need to reduce their breathing in the diaphragm. And the problem is that we don't have diaphragmatic breathing automatically, or sometimes elderly people, when we come to the course, we just cannot move even the abdominal muscles, because we have been using the chest for many decades already, and we don't know how to breathe using abdominal muscle, and diaphragmatic breathing is even more difficult for them. So that's a great advantage, because with devices it's much easier to practice. Next factor is students are able to achieve much higher final results for the body oxygen test. The final CP is higher while spending the same time. That means if we have session like say 15, 20, 30 minutes long, the overall result is better. Next factor is overall progress, of course, would be faster as well, up to 30, 50, maybe 70%. Nearly 2 times in some students can be found. So final CP is higher, overall progress would be also much better when students apply breathing devices. When we achieve certain level in the body oxygen test, I teach them how to apply Buteyko breathing exercise, and I found we've developed diaphragmatic abdominal breathing. We are able to learn really easy. May take 1-2 week time depending on the person, on the situation. So that became another innovation for the normal breathing course. We start with the breathing device, and some people may say that it's not a Buteyko breathing technique, but because Buteyko was against breathing devices. And here I do apply breathing devices, and not only me, I know that by now dozens of other Buteyko teachers, we teach the same to the students. We start with the breathing devices because it's easier, faster way. And I believe there would be also even patients or student situations, like especially severe ones, where application of the method, of the traditional Buteyko method with reduced breathing exercises would not allow certain people to restore their health, because sometimes we take people who can be terminally sick, and if we apply 2 hours of Buteyko exercises, we probably would not be able to recover if we are really so sick, the body has so much damage produced. While it's possible to imagine that some of these people, when applying breathing devices, we would be able to recover their health, and in many cases, if we achieve a certain level, we can progress even further and further, finally restoring their health and eliminating all symptoms, all medication, anything like abnormal that we have in their bodies because of application of the breathing devices. And that also the reason why I believe that application of breathing devices should be actually considered very seriously by all Buteyko teachers. Now, next factor which relates to Buteyko breathing exercises relates to more kind of systematic approach. By my education, I have PhD in math and physics, and I worked like for many years as a teacher in high school in Canada, like teaching calculus, algebra, geometry, like those like last years of school, like 17, 18 years old students. So I kind of have very systematic mind and like to have all these tables, graphs, charts, like to show all these effects. So what I also did in relation to Buteyko breathing exercises, kind of to make it more systematic, easier to teach, and also easier to understand for students, I introduced, for example, 6 preliminary requirements for breathing exercises. I expanded the list of contraindications so that people in the past, for example, in Soviet sources, we can find that they would say people with hypertension and panic attacks, they should not practice ordinary or normal Buteyko breathing exercises like with light air hungers, and even the CP test can cause problems for those groups of people. But there are also many, and we also mentioned that women during first trimester of pregnancy, we practice too much, we can experience spontaneous abortion. So it can be also negative effect and can be contraindication. So we need to know how to practice in an easier way so that we progress slow and there is no strong reaction of detoxification which causes abortion. And so having this list of contraindications or the kind of more temporary restrictions, which also relates to presence of transplanted organs depending on the match, presence of brain traumas and acute bleeding injuries, blood clots, acute stages of diseases, how to apply Buteyko breathing technique for insulin-dependent diabetes was described in Soviet literature. I did not mention this factor. We need to have also special adjustment related to blood sugar drop due to breathing exercises. And in addition to that, I developed 3 effects, developed like criteria how to recognize them and how to deal with them, which relates to overtraining. So the overtraining due to breathing exercises, loss of CO2 sensitivity and blunted CO2 sensitivity, there are different specific effects relates to when people train too much or due to certain symptoms, factors that we have, certain conditions, situations that we have, we are able to experience negative effects because of breathing exercises which are not correctly applied. So it should be done in a safe way.